Hello and welcome to Pregnancy Info. Here we are to describe fertility supplements that can boost the fertility. When trying to conceive, doctors may suggest a variety of things to help optimize one's health, and taking vitamins and supplements is typically on the list. The importance of good nutrition is well established during pregnancy, influencing embryonic and fetal development and thus pregnancy outcomes. There is growing evidence that certain supplements and micronutrients may help in many ways for those trying to conceive, including boosting the overall quality of women's eggs and male sperms as well as the overall health of a woman's pregnancy. Here is a list of a few important vitamins and supplements to consider taking when you are trying to conceive. It's important to note that you should be receiving many of your daily vitamins and minerals from food sources. But if you have trouble getting all the recommended daily amounts through foods, supplements are a great addition to your diet. If your prenatal vitamin doesn't include some of these standalone vitamins and supplements, you might want to consider adding a few of your daily intake after consulting a primary care doctor or your fertility doctors to see if these vitamins and supplements are right for you. Number 1. Folic acid or B9. Most people associate folic acid as a prenatal vitamin, but it can also be a really great supplement for those who are trying to conceive. Folic acid is associated with greater chances of getting pregnant naturally and improves success for those undergoing fertility treatments. Medical professionals also recommend that men take folic acid when trying to conceive as it can improve the quality of their sperm. Suggested amount 400 to 1000 micrograms for women, 400 micrograms for men. Vitamin B6 and B12 both are essential nutrients needed for your cells to grow, develop and survive and are important in both men and women. B6 supplementations has been associated with improvement in hormonal balance in women, leading to improved PMS symptoms and better ovulatory cycles, which in turn improves the odds of becoming pregnant. Suggested amount for B12 1000 micrograms once per week for men and women, and for B6 1.4 milligrams for men and 1.2 milligrams for women daily. Myoinositol or B8 and D-chiroinositol. This is naturally occurring in almost every tissue that is involved in insulin and gonadotrophin signaling, affecting follicle maturation. In women with PCOS, myoinositol is associated with improvement in insulin resistance and ovulation. During pregnancy, it may also help prevent gestational diabetes. Suggested amount 2000 mg 2 times a day of combination of myoinositol and D-chiroinositol. Vitamin C. Vitamin C is a powerful antioxidant and may promote healthy reproductive systems in both men and women. For women, vitamin C can reduce the negative impact of free radicals, in turn reducing cellular damage, which may then counter aspects of ovarian aging. Research shows vitamin C supplementation is associated with shortened time to pregnancy. As for vitamin C's impact on male fertility, the Nutrition and Food Security Research Center found that taking vitamin C with vitamin E improved the number, motility, and sometimes DNA quality of sperms. Suggested amount 90 milligrams minimum daily for men and 75 milligrams minimum daily for women. Vitamin D. Vitamin D is important for the development of healthy hormones and is thought to play an important role in many chronic diseases from diabetes, autoimmunity, cardiovascular disease, and cancer. Those trying to get pregnant can test for vitamin D level to see if they are deficient and start taking supplemental vitamin D if necessary. Sufficient vitamin D level has been associated with improved pregnancy rates. Additionally, this vitamin is thought to improve semen quality in men. Suggested amount 2000 to 4000 international units daily for men and women. Vitamin E. Most people will recognize vitamin E from their skincare tons of products, including this one to help reduce wrinkles. Because vitamin E works to prevent cell membrane damage, that's also exactly what makes it greater vitamin to boost fertility. A study named vitamin E as an antioxidant in female reproductive health suggests that vitamin E improves women's overall reproductive health and improves egg quality. For men, it helps to boost sperm quality, and when taken with vitamin C, has been shown to reduce DNA fragmentation. Suggested amount 200 to 400 IU daily for men and women. Coenzyme Q10. Coenzyme Q10 is another natural antioxidant that counters oxidative stress that increases with age. This is evidence that coenzyme Q10 supplementation improves chance of pregnancy, especially in women with diminished ovarian reserve or in women over 40. Similarly, in men, several studies reported improvement in both sperm concentration and motility with CoQ10 supplementation. Suggested amount will vary depending on your specific needs, but typically between 100 to 600 mg per day is often recommended for men and women. Omega-3s. Omega-3s can be helpful for men and women by countering inflammation throughout the body, thereby promoting overall health as well as boosting men's sperm motility and helping achieve pregnancy in women over the age of 35. Omega-3s may help to overall egg quality in women trying to conceive. You can find omega-3s in seafoods, or you can try fish oil pills. If you are getting your omega-3s via a supplementation, you will want to look for DHA, as that is the most bioavailable for your body to absorb and use. Suggested amount 500 to 1000 mg daily for men and women. Iron. Taking an iron supplement may help women prevent iron deficiency anemia. Ovulatory infertility can be associated with an iron deficiency, and a long-term study by the Department of Nutrition and Epidemiology of more than 18,000 women showed that supplementing with iron appeared to decrease the risk of ovulatory infertility. Whether you may benefit from supplementation, may you also be guided by measuring ferritin levels to determine degree of iron deficiency. Suggested amount 27 mg daily for men and women. Selenium. Selenium is a trace element essential to generate glutathione that protects cellular membrane. Many view selenium as a supervitamin for fertility because of its antioxidant powers. It's recommended that pregnant women take about 60 mcg daily when trying to conceive, as lower levels in the early stage of pregnancy may lead to complications such as miscarriages and smaller birth weight of the baby. It's also a great one for men as well. Selenium and its associated proteins together ensure viability of sperm, and abnormal levels may affect motility and quality. Suggested amount 55 micrograms daily for men and women. Zinc. Zinc is another essential mineral that appears to play an important role in both sperm quality and egg development. Studies have suggested that a zinc deficiency could lead to low sperm production and quality reserved by supplementation. As for zinc and female fertility, a 2019 study from Robinson Research Institute found that lower levels of zinc in the blood were associated with longer time trying to conceive. So, zinc may help a woman's fertilization and egg development, but there is less research on benefits of zinc supplementation in women. Suggested amount 30 mg daily for men and women. N-acetylcysteine. This is an amino acid that antioxidant effect by stimulating glutathione production. Research shows that NAC reduces oxidative stress, possibly reduce chromosomal damage, leading to improved egg and embryo quality. NAC may also reduce insulin resistance, which has been shown to improve ovulation rates in women with PCOS in men. NAC supplementation is associated with improvement in sperm quality and quantity. Suggested amount in women pre-conception 900 mg 2 times a day, and after conception 600 mg a day through first trimester. In men 600 mg a day. L-arginine. L-arginine is an amino acid that is involved in promotion of blood flow by helping the body produce nitric oxide, leading to vasodilation. L-arginine supplementation in men may help with erectile dysfunction and increase sperm production and motility. In women, for those with issue with the thin uterine lining, and an increase in blood flow may help thicken the endometrial lining. Some studies also reported improved outcomes in those who previously had failed IVF cycles. Suggested amount 1000 mg 2 times a day for men and women. Acetyl L-carnitine. Acetyl L-carnitine is a form of an amino acid that is involved in mitochondrial oxidation for long-chain fatty acids. It has been primarily shown to improve sperm motility. Limited studies suggested improvement in symptoms associated with PCOS, which in turn may improve fertility. Suggested amount 500 to 2500 mg daily for both men and women. Best taken first time in the morning. Taking these vitamin and supplements can be beneficial for your overall health as well as before conception. It's important to talk to your doctor before using these supplements and how they can increase the chance of conception and a successful pregnancy. Not all supplements should be continued once pregnant, and you should consult your physician. Maintaining a healthy balance of these vitamins can be beneficial in your fertility journey, but in your overall health as well. So share this information with the pregnant women or the women who are trying to conceive. Take care. Bye-bye.